Building healthy bones is crucial for maintaining a healthy life. Your bones not only provide strength, but also protect vital organs, anchor muscles, and store calcium. If you want to know how to maintain and manage strong and healthy bone mass, then this episode of Health Point is for you. Hi, my name is Hrishikesh Patel, Certified Health and Nutrition Coach, and welcome to Health Point, a short 5-minute show that brings you meaningful health and wellness tips from reputed doctors. Bone is a remarkable tissue with a functional structure that is strong enough to withstand intense physical activity, adaptive enough to respond to changes in activity, and lightweight enough to allow efficient movement. Bone tissue possesses the unique quality of resiliency, which enables it to continually renew itself or remodel throughout life by breaking down old bone and replacing it with new bone. There are lifestyle factors such as diet and exercise that can influence whether we reach our full bone mass potential. Most people will reach their peak bone mass between the ages of 25 to 30. By the time we reach age 40, we slowly begin to lose bone mass. Today, we have Dr. Hrishikesh Pai, President of the Federation of Obstetric and Gynecological Societies of India, or commonly known as FOGSI. Dr. Pai, welcome to another episode of Health Point.
Thank you. It's a great pleasure to be here.
Dr. Pai, you mentioned the term peak bone mass. Can you help our audience understand what it really means?
Absolutely. Peak bone mass refers to the maximum amount of bone tissue.
Does peak bone mass affect both men and women?
Yes, it does. Good bone mineral density in later life depends on achieving a healthy peak bone mass during the growth years and the subsequent bone loss that naturally occurs with age. This applies to both men and women.
You mentioned that some factors affecting peak bone mass cannot be changed. Could you elaborate on some of these factors?
Of course, factors like age and race have a significant influence on peak bone mass and are typically unchangeable.
So how does peak bone mass affect our health as we age?
While everyone experiences some degree of bone loss with age, individuals who have achieved a higher peak bone mass against osteoporosis and the related fractures that often accompany it in later life.
Thank you, Dr. Pai, for clarifying the concept of peak bone mass and its role in our lifelong bone health.
You're most welcome. I am glad I could shed light on this vital aspect of bone health, and I hope it encourages everyone to take proactive steps in caring for their bones from young age.
So, let's see what some of our other doctors have to say about this.
An interesting fact about the human body is the skeleton, a living, dynamic tissue. Throughout life, bone must adapt to the stresses imposed upon it, and its ability to do so depends both on lifestyle and genetic factors. Paying attention to lifestyle factors such as diet and physical activity throughout life can yield bone health benefits equal to or greater than those offered by the most powerful drugs currently used to treat osteoporosis.
Creating the optimal environment for healthy bones start early, even before birth. Optimal nutrition and healthy lifestyle in an expecting mother can make a difference to her child's future bone health. Although men have a higher peak bone mass, they also are at risk for osteoporosis, especially after age 70, when bone loss and fracture risk increase significantly.
Bone health is important at every age and stage of life. In or 70, eating right, exercising and getting enough calcium and vitamin D can increase bone strength and minimize bone loss. And remember, achieving peak bone mass timely and adequately will help beat osteoporosis in the future. That's all for now. See you on the next episode, and don't forget to keep it healthy.